Welcome to the Erectile Dysfunction Radio Podcast. This is the podcast dedicated to educating and empowering men to address erectile dysfunction, improve confidence, and enhance the satisfaction in their relationships. This podcast is brought to you by erectioniq.com. Learn more at erectioniq.com.
Welcome to the Erectile Dysfunction Radio Podcast. I am Mark Goldberg, certified sex therapist. I am deeply passionate about working with men like you to help resolve their ED.
My name is Casey, podcast producer here at ED Radio. Happy to join Mark once again. So Mark, today we're going to be discussing erectile dysfunction and sex therapy. I'll ask you to just kick off today's discussion by describing and defining what sex therapy is.
Sex therapy is a form of talk therapy. So let's just take a moment to talk a little bit about what talk therapy is. So talk therapy is it's an approach to helping people with mental health and mental illness challenges. It has developed tremendously over the last century. Many people are familiar with Sigmund Freud and the notion of lying on a couch and talking about their problems. And therapy has certainly developed into a much more broad field over a whole bunch of years since Freud. And there are multiple forms of therapy. There's emotional therapy, couples therapy, cognitive behavioral therapy, which all seek to help people alleviate certain emotional and mental challenges they might be facing. So sex therapy is a form of talk therapy that focuses on all types of issues and challenges pertaining to sexuality. And in particular, the type of sex therapy that I do helps people with the mental aspects of sexual dysfunction.
Is there anything more you want to tell us about the different forms of sex therapy?
So, as I mentioned, there's different modalities or different approaches when it comes to therapy, and sex therapy is really no different. A way that I would think about sex therapy is that a sex therapist is somebody who has a wealth of knowledge about sexual issues and also has a wealth of knowledge about mental health therapy. So depending on who your sex therapist is will inform the way they approach sex therapy. Some sex therapy is very behavioral. So that means that your sex therapist would be giving you a lot of things to do at home behaviorally. Other sex therapists are more cognitive, which means they're focused more on what you are thinking. Some sex therapists are relationship-based, so they focus on the way you connect to other people and how that impacts your sexuality. So sex therapy can take on a whole bunch of different forms. A well-trained sex therapist will have skills in multiple modalities in order to be able to best meet the unique challenges that each person or each client comes in with.
Now, is sex therapy just for couples, or is it for individuals? Is it a mix of both? What's more common there?
So I'm not sure what's more common. There certainly is sex therapy for individuals, and there is sex therapy for couples. There are a number of issues that are very much couples-driven issues. So one of the most common challenges that couples sex therapy focuses on is what's called discrepancies in desire. Desire is an issue that we have touched on. Low libido, there's also high libido, and most commonly, two people who are in a relationship are not going to experience the same level of desire, the same frequency of desire, have the same wants or interests, and that's what we call discrepancies in desire. This can create a lot of conflict between couples, and they can struggle to figure out how to resolve this in an amicable way. This can also cause a lot of distress in each partner on their own. So couple sex therapy is something that would be used for something like discrepancies in desire. For issues pertaining to sexual dysfunction in one partner, the way I approach something like that is I would have an individual assessment to try to understand, are these individual factors that are part of driving or maintaining the sexual dysfunction? Or is the relationship contributing to the sexual dysfunction or helping to maintain it in some sort of way? Based on that initial assessment, a clinician is going to determine, or a therapist is going to determine, what the best approach is going to be to help resolve the sexual dysfunction. Now, I'll just add one more note. Sometimes the sexual dysfunction is not really the issue necessarily, but it's how the sexual dysfunction is impacting the couple and the relationship. And in those instances as well, couple sex therapy may not be solution-oriented in the sense of trying to resolve the sexual dysfunction, but it may be necessary to help the couple manage, adjust, or create a new sexual relationship together in the face of a sexual dysfunction.
Of course, this is the Erectile Dysfunction Radio Podcast, and we like to bring everything back to ED. So what can you tell us about sex therapy's role in helping men overcome erectile dysfunction?
So as I've mentioned on this podcast before, I am of the belief that the brain plays a very significant role in the erection process. And there are a multitude of factors that can interfere with the brain being in an optimal position or an optimal role to help men gain and maintain their erections. So sex therapy can help men identify and address the particular factors that are contributing to not being able to gain and maintain an erection in whatever setting that is occurring. Now, I will mention that sex therapy, when it comes to erectile dysfunction, does not have to be a very long treatment process. In fact, a lot of times men will come to therapy with the goal of resolving the erectile dysfunction. They may discover that there are larger issues going on inside of their thinking, levels of stress, and they may be satisfied with adjusting the level of stress down to a point that allows them to engage comfortably with their partner and gain and maintain an erection, but may choose to not pursue to fully address the underlying stress. So sex therapy can be something that is very brief and very goal-oriented, unlike other forms of therapy that may be longer term with less defined goals.
What other benefits of sex therapy are there besides helping with erectile dysfunction?
One of the primary benefits of sex therapy over other interventions is a man gets an opportunity to address concepts such as sexual pleasure, how he feels about himself as a man, potential challenges that are going on in a relationship, and a whole slew of other potential factors that a intervention like a medication just simply is not going to address. I understand that it's a little bit harder, certainly a time investment, unlike a medication, but I think that there are tremendous potential benefits that are far-reaching, well beyond just addressing sexual dysfunction.
And Mark, what would you say to someone who may be embarrassed to have such an intimate conversation with a sex therapist?
So I get it. I do understand how difficult it can be to talk about challenges, to talk about mental health, to talk about sexual dysfunction. And these are really, really, really hard topics. So first and foremost, I get it. In my opinion, and from what I have seen clinically, the benefits are tremendous. That's the way I would put it. The benefits are tremendous for men who go through this process. I have seen men make tremendous changes and shifts in a very short time that really just set their relationships in a different direction. And I get that it is embarrassing and I get that it's difficult to talk about these things, but there are people out there who can help you make this tremendously different and make it a whole lot better, and can also help you overcome those feelings of embarrassment in the process.
Mark, what would be the difference between sex therapy and something perhaps maybe a little more informal, like coaching or something of that nature? What are your thoughts on that?
So this is a really tricky question. I'm a little hesitant to talk about a particular difference or differentiation between sex therapy and sex coaching. I think there certainly is a overlap between that. I think the primary difference would be as follows. Therapy in general is going to look at and potentially seek to address particular mental health challenges. sex coaching, at least from my perspective, would be a little less focused on what some of the factors are that are getting in the way and a little bit more focused on how to progress forward in a positive direction. So it might include a little bit more education or psychoeducation, some very, very specific suggestions, but would potentially not address particular mental health challenges, which is more appropriate for the therapy realm.
Thanks, Mark, for that clarification. And I'll just ask if you have any other final thoughts for us before we wrap up today's episode talking sex therapy and erectile dysfunction.
So I guess coming off of the last question, the thought that comes to mind that I would just like to emphasize to our listeners is not to be intimidated by the word sex therapy. It doesn't mean that there's something terribly wrong with you. It doesn't mean that you have severe mental health issues. Sex therapy is really very similar to other forms of therapy. It just means that you're working with an expert who has intimate knowledge of how the brain and the body interact and relate, and how that impacts sexual function or a slew of other sexual issues. So think of it as going to any other therapy, which I know in and of itself can be a challenge, but certainly adding on the word sex, I don't want that to become something that is intimidating to our listeners.
Thanks for listening to the Erectile Dysfunction Radio Podcast. For more information on today's topic and understanding how the mind impacts erectile dysfunction, please visit erectioniq.com. That's erectioniq.com.